Are you practicing Ayurveda dermatology or willing to practice Ayurveda dermatology? Right? Then let me ask you one question. Whether these presentations are same or different. Whether these presentations, all the four are different patients, right? All the four are different patients. Whether they are same or different. You think they are different, right? They are different, right? They are different in clinical presentation. They have different pathology, that is different Samprapti. Then to practice successfully Ayurveda dermatology, we need to be understanding the Samprapti, right? Because it is said Samprapti Vigatanam Eva Chikitsa, right? When we look into these conditions, four conditions, the presentations say they have different Samprapti, right? They have different Samprapti, and we need to understand that because Samprapti Vigatanam Eva Chikitsa. Namaste, friends. Welcome to Dr. Mahesh speaking. Myself, Dr. Mahesh Sawaligmat. I am practicing Ayurveda dermatology and teaching Ayurveda since 2008. Welcome to my channel. Today, in this video, we are going to discuss about understanding Samprapti of skin disease. That is Kushta Samprapti, right? So, this is very important. Why Samprapti? Understanding Samprapti is important because it is the root, it is the base for successful practice of Ayurveda dermatology. Though Samprapti Vigatana is the base for practicing Ayurveda in general. As I am a dermatologist, I am an Ayurveda dermatologist, so I'll be discussing only about how to understand the Samprapti in the context of skin disease, right? So we are going to discuss that in this video. Now let us go to what text says, right? What Acharya. I have put here two references, one from Acharya Charaka, Charaka Nidanasthana, and second one from Acharya Sushruta from Charaka Sushruta Nidanasthana, right? So we'll see just one, and both are almost same, right? Let us see what it says. What Acharya Charaka says: Tatra trayo doshaha, Tatra trayo doshaha yugopat prakopam apadyante, togadayashchatvarah shaitilyam apadyante, तेषु शिथिलेषु दोषा प्रकुपिता स्थानम अधिगम्य संतिष्ठमाना स्थानेव त्वगादिन दूषयन्तः कुष्ठानि अभिनिर्वर्तयन्ति. But it says, what Acharya Charaka says, Trayo doshaha yugapad prakopam apadyante, means all the three doshas, Vata, Pitta, Kapha, all the three yugapad at once, they get prakupita, aggravated. Then Togadayas Chatvara Shaitilyam apadyante. Next, Tvak Rakta Mamsa and Lasika. Right? These four simultaneously become they attain Shaitilata. Shaitilata means what? Shitilata, loosening, right? Loosening, they get loosened, right? Teshu, in those loosened dhatus, four dhatus, Shitileshu, dhatushu, doshaha prakupita sthanam adhigamya. So in that loosened dhatus, Shitila dhatus, the three doshas which are already aggravated, they go and settle there. Santishtamana, they get settled there. Taneva, they those four dhatus, Twagadin, Taneva means those four dhatus, Dushayantaha, they vitiate them further and lead to Kushta, lead to skin disease, right? Same Acharya Sushruta also says, what he says, Tasya Pitta Shlaishmanau Prakupitau Parigrihyanilah Pravruddha Striryagaha Siraha Samprapadya Samudhuya Bahyam Margam Prati Samantad Vikshipanti, means these doshas, Acharya Sushruta starts with Pitta, right? He starts with Pitta Kapha, right? With the help of Vata. They move, they increase, and then they move to Siras and then go to Bahyamarga. There they accumulate. Yatra yatra cha dosho vikshipto nishcharanti tatra tatra mandalani pradurbhavanti. So these doshas where they move into the dhatus, there mandalani means skin lesions are formed. Evam samutpanna tvachihi doshas tatra cha parivruddhim prapya apratikriyamano abhyantaram pratipadya dhatun abhidushanti. So at that stage, if they are not treated, then what happens? They gradually further increase and they go deep inside. They penetrate inside and then vitiate the dhatus. Okay. So Acharya Sucharaka says first the dhatus, Tridosha Prakop takes place and dhatus become Sitila. At that time, at the Sitila dhatu, the doshas go settle and then they cause the skin disease. Whereas Acharya Sushruta says Pitta Kapha Pradhana doshas, with the help of Vata, they move in Tirrak Gati and go to Shaka, right? Wherever they accumulate there, the skin changes starts appearing. If at that stage, if they are neglected, then they penetrate deep and then vitiate the dhatus and lead to the skin disease, Kushta, right? Overall, both are same. This is the only Samprapti that we get in the text for the Kushta. How many Kushta are there? 18 types of Kushta, right? For all the 18 types of Kushta, which have different presentations, Acharyas have explained only one Samprapti, right? So that is why what we see in clinical practice, that is why I have put this image in the beginning, right? Same Samprapti, but we see these type of presentations. This is scaling, right? Scaling is not there. Fish skin like scale. Here pustules are there. Here oozing and all secretions, stickiness is there. Here no papilla changes, only macule. White patch is there, right? Only white patch is there. Now imagine, or is it possible to imagine all these have single Samprapti because they have different presentations? Whether they all have single Samprapti? Whether this is what Acharyas meant to say us that Samprapti means what common Samprapti for Kushta is said is this. Is it so? No, it's not like that. We need to understand what is said. Trayodoshaha yugapat prakopayanti. One, Acharya Sushruta says Pitta Kapha aggravated with the help of Vata, they move. Right? That means there is influence of each doshas on each other. Right? We need to understand that. Right? For example, take just psoriasis. Right? These patients, how many are there? 1, 2, 3, 4, 8 patients. All the 8 are different patients, and all the 8 are psoriasis, and all the 8 have different clinical presentations. Right? They all have different clinical presentations. Can we say they all have same Samprapti? Can we say? Because Samprapti Vigatane Meva Chikitsa. If we want to treat them successfully, such cases successfully, we need to break the Samprapti, right? Samprapti Vigatana, right? Is it possible with the same explanation what Acharya Charaka or Sushita said? Or can we get some reference? Can we get some help from the treatment principles that our Acharyas have explained? When we look into, you take any Samhita, when we look into the medicines explained or the line of treatment explained, we will find that mostly they are targeting Pitta or Rakta. Ashray, right? They are targeting Pitta or Rakta, right? But simultaneously, they are considering association of Kapha and Vata with the Pitta. That is what is going to make the difference, right? So, what is Kushta? What is the meaning of Kushta? What is the meaning of Kushta? Kushnati vapuhu iti Kushtaha. But it means disfigures the body. Body means external surface, the skin mostly. It causes the disfigurement of the body. It converts the healthy skin into an abnormal one, disgraceful one, ugly one, and that is the reason why it is called as Kushta. Kushnati vapuhu iti Kushta. So what is happening there? Conversion is taking place. The healthy normal skin is getting converted into a deformed skin, right? What it is called as? It is conversion. That conversion is called as Paka, right? That conversion is called as Paka. So what is Paka? Conversion of the tissues, conversion of any tissue is called as Paka. And what is responsible for Paka? What is responsible for Paka? It is Pitta, right? So as per my experience of 18 years or so far 17, 18 years, I can say that as per my understanding with the patients that I have observed, three types of pakas we can see. There may be multiple also, but for my understanding, there are three types. We'll see them. So if you are first time visited our channel, please subscribe and please like the video. And if you have any questions, any queries, please write them in the comments, comment on the video, and please share the video to the people whom you feel it will be useful. Okay. So as per my understanding, based on my clinical experience, there are three types of pakas. In short, I have explained these in one of my previous videos, right? There are three types of pakas that can happen. All for all the three paka, whatever paka it is, the base is pitta, right? Pitta, right? So what is going to make the difference? What is going to make the difference in paka is the association of kapha and vata with the pitta. How vata and kapha, or how much vata and kapha, or what guna of vata and kapha are associating with the pitta, that determines the nature of the paka. Right? It's like, when we are making rice, right? When we are making rice, at that time, quality of the rice, next quantity of the water, and the amount of the fire that we set in, right? These three are going to determine the nature of the paka, right? If the flame is more, at that time rice is more and water is less, what will be the condition? The rice will get burnt, right? The rice will get burnt. Now, flame is medium, water is more, rice is more, then what will happen? What will happen? It will become more watery, right? It will remain more watery. When flame is correct, water and rice quantities are also similar, required, how much it is needed, then we will have a right quality of the cooked rice, right? So likewise, the paka is happening. We'll see them one by one. See, first one is here, try to understand it thoroughly. It's most important. Most important. I think you won't find this type of explanation in any. I'm not claiming like that, but mostly you may not find this type of explanation. Right? Consider pitta is, as I'm telling, pitta is as not I'm telling, as text say, pitta itself is responsible for paka. So when pitta is there, increased pitta is there. With that, when more kapha is there, like Acharya Sushruta said, pitta kapha. So at that time, vata is less. So what will be the outcome? Pitta will be drava pitta. Pitta will become drava. It will be having dravata. So what type of lesions will be caused? The lesions with oozing, pus formation, secretions, right? Like this. This type of lesions are caused when pitta is more along with more kapha and less vata, because the shoshana is not taking place. The liquid part is not getting dried by vata because vata is less. So that is why the outcome will be, the skin lesions will be of Kleda Bahula. Right? There will be secretions, there will be oozing, pus formation, right? That type of presentations as I have shown here, or you can see in this patient, right? This type of presentation. So if you are actually interested in practicing Ayurveda dermatology, I have a complete 50 hours course, Ayurvedic management of psoriasis and dermatological manifestations due to Visha. It's completely online. It's available in our platform. Actual course price is more than 10,000. But actually we are selling on our platform for all who visit our platform 7,000, but exclusively for my YouTube audience I'm giving additional 700 rupees discount. Only thing you have to do is you have to go to that page. When you go for payment, at that time use this promo code YT700 and apply. You will get 700 rupees discount, and link is given in the description, right? Okay. So this is second presentation where pitta is there to cause paka. Pitta will be there. There is little kapha and more vata. Kapha is also there. More comparatively more vata is. Then what happens? Some amount of the fluid part is right. Yet the pitta is snigdha only. Sasneha pitta. Pitta is sasneha. At that time we see scaling and oily skin, as you see here. Scaling and oily skin. See, I was telling you about the rice, right? Imagine you are making chapati, you are making roti or chapati, and you are using a regular tawa, not the one of non-stick kind, regular tawa, iron tawa, whatever. So we make the chapati and we put it on the tawa, right? And we heat it. What will happen without putting oil and all? If you put, what will happen? The more and more it gets, heated, dried, shoshana takes place. Means now more vata, more pitta. So it is ushna vata, more shoshana. Then what happens? Chapati will stuck to the tawa and you will get the scaly lesions. Scaly chapati. It will stick to that. Right? Now add little oil to that before putting that chapati, rolled chapati, the one which you have prepared. Add little oil to the tawa and put that and heat it. What will happen? We will get well baked chapati which will not stick to the tawa, right? The same thing happens here. So in psoriasis, what will be there? The scales are automatically peeling. The scales are automatically peeling. The image first one I shown you, what was that? Ichthyosis, right? Matsya shakalopamam, fish scale like. In that what happens? More vata, less kapha. More vata, more pitta, means completely it is dry air, dry and hot air. Then what happens? The skin becomes scaly, but it won't peel off. Why it is not peeling off? Because there is no moisture. If you see the pathology or pathophysiology of that ichthyosis, you will find that there will be no sweat formation at all. Sweat itself is bringing that kletha to the tvacha, right? Sweda, kletha vahanam. Right? It does the bring the kletha to the skin. That is why we have soft, moist, oily skin, right? So now what happens? If it is not there, completely when it gets dry, at that time, the skin becomes scaly, but scaling will not be there. But when Alpa Dravata will be there, Sasneha Pitta will be there. At that time, we see scaling and oily appearance. You can see this patient where by seeing we can make out that maybe patient might have applied some oil, but practically he has not applied any oil. Here also you can see the shiny, glossy, but the scales are peeling off. They are going off and they are very soft to touch also. They are delicate. They are not hard. They are not brittle. They can be rolled, right? So this is one type of part, another type of part. The third type of paka is where more kapha, more pitta and vata. More pitta, more vata. Then what happens? The kapha gets completely dried. Now consider it as Agni, this Vayu, and this is Prithvi with Jala. Kapha is Prithvi and Jala Mahabhuta, right? When this Agni and Vayu mixes, what will become? It will become hot, dry air. So when hot, dry air is considered as clay, Kapha as clay, Prithvi and Jala Mahabhuta is there. So when this hot air, that is Agni and Vayu, does Shoshan of that, what will happen? Like a pot. When earthen soft, clay is converted into earthen pot, at that time it is very soft, delicate, right? So to make it brittle, hard, what is done? It is heated, it is burnt. Same thing happens here. When more kapha is there, more vata and more pitta, the lesions become hard, thick, stone-like. Pashana katina. Acharya Charaka said, Pashanavat, Pashana katina. Hinakara sparsham, kitiba and all. You can see here, hard, rough and bulky lesions are formed. Right? It's like Karapaka. Karapaka is taking place. Right? So what is happening here? More kapha is there, but along with that, more vata and more pitta. If more kapha and more pitta was there, less pitta was there, less vata was there, then oozing, sticky lesions. Now pitta is also more, vata is also more. Now what will happen? That clay gets dried. It will become hard, right? Like a pot. So here the lesions become hard. Lesions become hard, right? I think you are understanding and you understood what I am telling, right? So overall, there are three types of presentations, right? When more kapha, more pitta is there, less vata is there, at that time the lesions will be having more of kletha and all, right? Srava, okay, kletha, parisrava, such lakshanas are seen. When alpa kapha, alpa vata, or little bit more vata, not as more adhika in this as in this third stage I am telling. So this more pitta, less kapha, more vata. So sasneha pitta will be there. At that time, lesions will be oily, soft, delicate, and they are not hard. They won't break. They can be rolled. When pitta, kapha, and vata, all the three become more. At that time, if more vata, vata becomes too ruksha, and Pitta is too Ushna, then it will become like Ushnavata and Kapha gets Shoshita. Because of that, hard, rough, bulky lesions are formed. Right? This is what we have to understand by the Samprapti Vigatan. Okay, so all these are caused by the Paka, but the variation in clinical presentations is determined by the association of Vata and Kapha, along with which guna of Vata is dominant, which guna of Kapha is dominant. Based on that, the clinical presentations vary, right? So when we understand that Samprapti, because Samprapti Vigatane Meva Chikitsa, so based on that, medicines are selected, right? Samprapti Vigatane Meva Chikitsa means to do Chikitsa means we have to select the medicines or treatment. So what should be the base of selection of medicine? Important base is all the medicines we select should be Pittahara or Pitta Shamana in nature. Must and should. If not, at least they should not be Pittakara. At least they should not be Pittakara. Even if you see Kaphavata or Vata Kapha Pradhana diseases, their Gritas are explained. Grita is basically Pitta Shamaka. Right? While doing Vata Shamana, Pitta Prakopa should not be allowed. While doing Kapha Prashamana, Pitta Prakopa should not be allowed. Right? Likewise. So while selecting Pittahara medicines, do not forget giving importance to Vata and Pitta. Right? Vata and Kapha, sorry, typing mistake, Vata and Kapha. While selecting Pittahara medicines, do not forget considering Vata and Kapha in that. Okay. Now I told you Doshagnata, right? Whether selection of right medicines, whether Doshagnata itself is enough, that we will see in some other video. We'll be coming with many videos. I'll be coming with many videos in this pattern. These are kind of like, strategies of Ayurveda dermatology, right? We'll go to that we'll see them in future videos. Okay. So actually, if you are interested to learn and practice Ayurveda dermatology, I welcome you to my 50 hours dermatology course. It's completely online. Anytime, anywhere, at as many times as possible you can watch. Pre-recorded videos will be there. There will be periodic live sessions where question answers, solving the problems will be there, and it's completely case based. There is no theory. Only 10% you can find theory. Remaining 90% is completely practical or case based study, and it is lifetime access you get. And as I told you, currently on our platform it is 7,000, and if you are as only for my YouTube audience, you will get additional 700 rupees benefit. So link is there in the description, and you can go to that link and you can join our course. If you have any more doubts or any queries about the course, you can WhatsApp me on my number or you can mail me. And don't forget to like. If you have liked this video, if this video has benefited you, please like and subscribe to our channel if you are new. And if you have any questions, any queries, and what you feel about this video, please write them in the comment section, and also share this video with all your friends and those you feel will get benefited by this video. Okay, thank you for watching and see you again in next video. Take care, study well, take care, study well. Namaste.